We spend a lot of time on our feet, and if your feet hurt, you know your whole body hurts. And here to help us with those pesky foot pains is Dr. Corey Griffith from the Clintonville-Dublin Foot and Ankle Group. Good morning.
Good morning.
So how long have you specialized in medical and surgical conditions of the foot?
I've been in practice for the last 10 years. I did 3 years of surgical training down at Grant Medical Center and have been in practice ever since.
So what does your practice do? Who do you treat? What type of treatment do you do?
So we see everybody from adolescents to adults, and we treat anything and everything that involves the foot and ankle, including Achilles tendonitis, heel pain, bunions, hammer toes, flat foot reconstructions or flat feet, high arched feet, and the list goes on.
What are the most common type of conditions do you see at your practice?
Some of the most common things we see is plantar fasciitis or heel pain, Achilles tendonitis, stress fractures, bunions, hammer toes, flat feet, Seaver syndrome, which is more of an adolescent type of condition that we see a lot of.
Let's talk about plantar fasciitis.
Mm-hmm.
What is that?
It's the most common thing that we see from a heel pain standpoint,
Mm-hmm.
and what it is inflammation of the ligament on the bottom of the foot. The ligament, the plantar fascia, is responsible for maintaining the arch of the foot, and over time, through stress and strain, the ligament gets overstressed and causes inflammation and subsequently causes pain.
How do people know if they have it?
From the symptoms that they have, I mean, the most common symptom would include getting out of bed in the morning, kind of having that heel pain centered directly under the heel. That kind of loosens up as things get moving. As it gets further along in the pathology, the heel pain can be pretty much all day long. Some remedies as far as treating the plantar fasciitis, you can, some home remedies would be starting off with some stretching, good shoes, anti-inflammatories, and then if it doesn't respond to that, then more than likely need to see a doctor.
How do you treat that condition?
There are 4 mainstays that I employ. One, I start off with typically a cortisone injection, just kind of calming the inflammation down.
Oh, I don't like shots.
Yeah, nobody does, but and then after the injection, we start off with some stretching exercises, some orthotics, and then anti-inflammatories. Those 4 things in time usually kind of settles this down.
What's the main thing that we can do to take care of our feet?
Proper shoe gear, and from a fitness standpoint, making sure that we go about things in a reasonable way.
So if I'm experiencing any type of foot, ankle pain, how can I contact you?
There are 2 ways. You can call us directly at 614-267-8387, or you can contact us online at www.dublinfootandankle.com.
Well, Dr. Griffith, thank you so much for being here with us today. So nice to meet you.
Nice meeting you. Thank you.
And if you are experiencing any foot or ankle pain, be sure to call Dr. Griffith. The number is on your screen.